Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Hello, my name's Virginia Polkey. I'm married to my husband, Mr. Gregory Polkey, and we've been married 35 years. We have 7 children, 4 girls and 3 boys. One of our children died at 23 from drugs overdose, from methadone. But we're a very happy family, we're a very Christian family, and we've always, I feel like, I've worked all my life. I worked in Marks and Spencer's for 15 years as a retail operator. I love people. And I love being involved in my church. I work as a volunteer for the Legion of Mary. I work with people who are sick in Lourdes. And in July 2012, I got the devastating news from my consultant that I had lung cancer. I was quite shocked, although I'd been very ill with this chronic cough for about a year.
Virginia's come in today to tell us about her cancer diagnosis. And we haven't met before, but I heard you say about your lung cancer diagnosis. We haven't had that many people with a lung cancer diagnosis come in, so it's really useful that you've come in, so thanks for that. You mentioned about smoking straight away, and I just wonder what your comments on that are, because it's a very emotive area. If you've been a smoker, whether to think, was that the cause? What's your feeling about smoking and how, it's affected you personally?
I used to smoke very minimal. I gave up smoking 20 years ago, but I was a very small smoker. But I also worked as a bar lady in the bars, and the passive smoking. So I'm very anti-smoking,
right.
And I don't like the smell of smoking. And now I've been diagnosed because my consultant said it was lung cancer caused by smoking. I can only blame myself. I can't blame God. I can't blame anybody else, because the lung cancer was my own doing. So by my smoking, I caused my lung cancer. So if I had my time again, I would never, ever, ever smoke. And I'd like to, it's hard to explain to people how dangerous it is, and it is very dangerous to smoke. And them cigarettes, because that's why I've had the lung cancer.
Yeah, I guess everyone knows there is a risk associated with it, but when you're actually involved in smoking on a day-to-day basis, you don't necessarily think about it, do you? So it's very easy to have that habit, and then it become a very long-term habit over months or years, I guess. So you said about your diagnosis in 2012, wasn't it? How did that come about?
That came about, I went to see my GP because I had a chronic cough. People were actually commenting, I'm in the choir at church, and people had come up and say, you've got a real bad cough, and you get to the GP. And I did go to the hospital one day because I was so ill down the casualty end. I went for an x-ray, and the x-ray confirmed it, chest x-ray.
They found out from the x-ray, did they?
Then it went on to have more scans and nuclear scans.
Yes.
And it was definitely a stage 2 cancer. In fact, the surgeon said I was very lucky. He said when he operated, he said that I was lucky that I was able to be operated on. Another few weeks I'd have been inoperable. So I class myself as very lucky,
I see.
Even having a lung cancer, to be alive.
Were you somebody who preferred to have as much information as possible at that stage, or just what you needed to know?
I think I wanted to know everything, yes.
And did you get sufficient information at that stage?
I got every information proper, yeah.
And what was your understanding about the extent of your personal cancer, your lung cancer at that time?
They weren't able to tell me anything like that until after the surgery.
And then after, what did they say?
They found that after the surgery, I had to wait quite a while to get the information. It's got into my lymph nodes as well. So,
and I mean, I know it's a very key question, and not everybody wants to have this information, and not everybody's told. But were you told roughly how the cancer would likely develop, or some people look at it in terms of how long they're likely to survive after they've got their diagnosis?
Yeah, because I was on the research, and I had a good surgeon, Mr. Raffingham. I asked him on those occasions I saw him in my outpatient appointments about the cancer, about the terminal side of it, and he said he couldn't tell me, he couldn't tell anybody. Nobody can be told, only that some sort of figures were given about if I don't have the chemotherapy, so many years, this, that. I didn't quite understand it.
Did you ever subsequently get that amount of information about the long-term outcome?
No.
And even now, do you have a sense of what your situation is?
No.
What's your personal belief on how your body's kind of coping with the cancer?
I've had a lot of problems after the cancer because of breathing problems. I was offered chemotherapy and I was told that it could cause renal failure. Well, I'm living with my husband who's in renal failure for the last 6 years from his failed transplants. So I decided on my own person that I didn't want the chemotherapy. I trust in God. I've had the surgery, and as far as the surgeon's concerned, he took all the cancer away with the lymph nodes. But I know from what I've read and what I know, the knowledge I've got, that when you have cancer, lung cancer in my situation, that cells are in my body, and so I know that in the back of my mind that I could become terminal now from this cancer.
So let me just clarify with you, because I think you're saying something very important there, which is that you had the surgery and it was reasonably successful, the surgery, and then you were offered the chemotherapy by the oncologist, but you took the decision yourself based on what you felt was right to not have the chemotherapy at all. You didn't enter into it. So you were you offered any alternatives? No, you didn't have radiotherapy.
Nothing.
And you didn't have any other treatments. So you really used your faith, or you decided to see how things would go.
Yeah.
And luckily, so far, you've not had any, am I correct, any further advancement?
At the moment, I suffer a lot from bronchitis problems, but I've just had another scan. I'm not out of the woods.
No.
But,
I mean, I guess from the perspective of people watching, there's a lot of people out there who are very nervous about the chemotherapy, and I guess you could say it's a personal decision. It's unusual to refuse it, but it's not unknown. People are allowed to refuse medical treatment if that's their true, honest.
But I was too frightened. I was too frightened to have it. Literally, I would have gone into hospital and been hospitalised. I was that bad.
Was it because of the prospect of a side
It
effect
wasn't
like
just so much.
renal
Yeah, I
failure?
was ill because I've got other problems like medical problems like high blood pressure and immature and things.
Yeah.
And when the doctor told me they clicked in the brain when she told me about that renal failure. It's like, I'm living with a man who's on renal failure.
Yeah, you had personal experience with that.
And also, I have to look after him.
You didn't
with
want
my
to
own.
go down that line yourself. I can understand that.
Well, I class myself really talking to you now as a miracle because if it hadn't been for Dr. Raffinham and the consultants, I wouldn't be sitting here because I'd be dead. Because he said to me, in another couple of weeks, I wouldn't have been able to be operated on. So I just have to,
You mean you sought help originally at the right time? Is that what you're saying?
if I hadn't gone for that X-ray and then carried on with that cough, I could have been in very serious, well, my friend died of cancer, but it was too far gone to operate.
Things could have been worse. Yeah, they were able to still operate.
I'm lucky. I feel like I'm really lucky, even though I've had cancer.
Well, that's positive. I'm glad you say that in a way, because it suggests to me that from your point of view, things have gone reasonably well after your decision. So let me ask you that in a different way.
Yeah.
When you decided not to have the chemotherapy, and time passed, do you feel that that was the right decision for you?
At the time I did, but I sometimes think now, if it does come back,
What would you do this
then
time?
and I can't blame nobody. I'm not blaming nobody because it's only my own fault because I didn't accept it. And I think if I'd have had the chemo, I'd probably been finished my treatment by now.
Although you could have
I could've-
access to further treatment if you needed it.
Yeah, that's true. I've been told I can have palliative care, but I think there should be more help for people who are really terrified of having chemotherapy.
Oh, I totally agree with you.
I've heard people say, I've got a friend in the church who's got a different cancer, who's refused hers as well. And
Yes.
it's nice to have somebody to talk to about it, actually.
I mean, if what you're saying is that you were understandably anxious and scared of the complications,
Yeah.
and you would have valued more support at that time, then we as a profession have a responsibility to help you through that, and ideally allow you to see the chemotherapy through with the minimum effect on you.
Yeah.
But I do realise it does affect some people quite profoundly. But it would be a shame to think you refused it just on the basis of the possibility of a side effect which you might not have had.
Yeah.
But I realise you did have the chance to talk to your own clinicians at the time about that. But did you feel you had enough chance to talk to them? Did you feel that it was adequately explained?
No. At this point, I was very upset about the chemotherapy when I was not given time to discuss my fears, my other illnesses.
Yeah.
And I did find it quite upsetting that my actual consultant wasn't prepared to give me the bit more extra care. And because I told her I was so terrified. I was terrified.
Yes, usually the medical team are quite invested in trying to get you to take up the chemotherapy.
Yeah.
Did they try and persuade you to have it?
No. No. They told me I would have to have a real strong
Cisplatin, one of the chemotherapy drugs?
Yeah, and I tried to be brave and take it. It caused a lot of problems with my family as well because my daughter's in Australia, she's a nurse.
Ah, right.
And I got a bit of pressure, and I said, it's my life.
Your daughter wanted you to take it, did she?
Well, everybody wants me to have the chemotherapy.
Yeah,
And
I can understand that.
And I had to put my foot down because it's me, I'm Virginia Polkey, my life.
Sure.
And I decide what I'm going to have,
That's a fair comment. You ultimately, it's down to you to decide for yourself. But your family were keen, and
to me to have it.
Which meant that you must have been a strong person yourself to say, "I've made my decision."
I wasn't going to have the operation when I went, when I came back from Lords. I felt quite well, when I first diagnosed.
Yes.
I thought I'd had a miracle. I know it sounds crazy. I thought I'd had a miracle,
So
but I
you
didn't.
went to Lords straight away.
Oh
did you?
yeah, when I was diagnosed, I went in the surgery and I had a lovely. The doctor was called Dr. Peake. He was absolutely fantastic. Oh, he was lovely. And I won't say anybody else. He was so nice. Even he showed it me on. He actually showed me on the screen. He showed me the cancer. It was massive.
Oh, the lung cancer specialist.
He got time for me. I felt like he got time.
Yeah.
When I told him I was going to Lords in 2 days' time, he said, "No, you're in hospital."
Yeah.
And he said because it was like it's a time thing. You see, it's like chemo.
You were seen by the respiratory team.
Yeah, it was lovely.
when you went to Lord's then, what happened there?
Well, I went to Lord's with this cancer under, that is being diagnosed, and it was like you're like hit with a cricket ball sick. And I went, because I go there quite regular, and it's like a real holy shrine.
Yes.
And people go there who are sick and get healed. So I was hoping I would get a miracle, which I didn't get one, obviously. And but I did feel better when I went there.
What do you actually receive when you're there?
Well, it's the waters. You go into the waters, you go to mass, you go to confession, you have the atmosphere. It's just a beautiful place.
Do you meet other people in a similar situation there?
I did speak to people who had cancer, and we pray for each other.
Yeah.
It was like a more or less the spirit, the mind, the uplift.
Yes.
I got
There's a sense of well-being.
I got the uplift I needed at the time. With the cancer being diagnosed, I had to have the operation. Going to Lord's helped me. Bad enough having a physical illness and then having a mental illness at the same time. It was really, you don't know what you're coming or going.
No, you felt emotionally better.
And it really helped me.
For going, yes.
It really helped. It was worth every penny, and I recommend anybody to go there.
Is it expensive to go?
It's not expensive to go. It's the travelling, because it's in south of France, in Lourdes, in South France. So you can go by airplane. It's about £200 on a train.
Yeah. Okay. I mean, that's useful for people to know, because not many people have got personal experience of going there.
And people who, sometimes we can, in the Catholic Church I belong to, especially some people who can't afford to go, there is like funds that can help people in the genuine to go, like, people are genuine.
Yeah, I understand.
As much as they can, we are quite good at helping people.
So let's come back to what's actually happened since then.
Yeah, all day.
What's happened in the last few months? Any developments?
I was very. I've had problems with the cancer operation, with breathing problems, but also I felt like I'm more positive on that, but I needed some help with the psychology, with my depression and things. Yes. And I've got a lovely lady called Sue Todd to help me, and I've only been a few times, and I never thought I'd need to speak to somebody, because I do volunteer work myself, helping people, but she's been very, very supportive. And I think now I need to get to helping other people and to find out how other people have been affected. Because, your family don't want to listen to it. My husband don't want to listen to me talking about cancer. But other people with the cancer, different sorts of cancer, I want to get to see how they're coping.
Yes.
And what help's available. I mean, the thing is, it's happened, and you've got to carry on, haven't you? I want to try and get the help I need for me, to be positive.
How did depression affect you?
Oh, absolutely. Well, the cancer every day got better from the operation. After the initial operation, but the actual, you wake up in the morning, it's cancer. When we're going to die today, and we're going to this, and you feel like you're boring when you go to your GP, and I was scared to go into the GP. You
didn't want to tell your GP about these problems?
Well, it's time. You have to stick to one thing when you go, and I've got other problems as well.
It is difficult within a constrained appointment.
Yes, but I've got one GP now. I've got about 10 GPs at my surgery, and I stick to the one doctor.
You've got one that you trust,
and he's absolutely been fantastic, and it's lovely to have that relationship. And with him, about my problems.
That's good. You need somebody on your side there.
Yeah,
particularly
that's been helpful
in primary care. Definitely.
And also this lady Sue Todd, and although she said she wasn't for depression, she's a psychologist. I don't know what the difference is. Never been to one before.
Well, I mean, she can definitely look at
she's
both
very
sides.
Good.
But it sounds like you're suffering from a lot of anxiety about the future as well. Is that fair?
Sorry, anxiety.
Anxiety. Worry about.
I've labelled a bit like that.
Were you worrying about what was happening in the future regarding the cancer?
Yeah.
Yeah. And if I put that in more black and white terms, I mean, people are worried the cancer might progress further, or it might come back later, or they might be just thinking about how long have I got left, or what's going to happen when I'm not around to the family, or what were the thoughts you were having?
Well, at the time when I was diagnosed with the cancer, I was a few months off my 60th birthday, and I'm just grateful that I've actually gone through that milestone.
Yeah.
And it is a bit of a worry in the mind, but if you sat and worried about it all the time, you wouldn't carry on with your daily living.
No.
I try to be positive rather than negative.
Well, that's good.
I'm trying to get the help out with my cancer. I'm trying to find the help, like going to the psychology lady, joining the group, to help to see how other people are reacting with it. Because it is a very frightening subject, isn't it, cancer?
Definitely, and I agree with you. You should get all the help you can. Where you can access it. I
don't want to be a depressant to people when people come along and say hello. I want to be. The cancer shouldn't stop me living.
No.
Because I've had the operation. I need to go forward. I just pray that it doesn't come back.
Yeah.
But at the end of the day, I need to be positive, and get the help in case I get any, comes back. Because I know lung cancer is a quite serious thing to have.
Now, have you learnt any techniques, or do you use any particular coping strategies to help you maintain that positive outlook?
No, I want to find out, like, because I've had breathing problems. I feel like at the moment, because I've not had the chemo, you see, I'm a bit like in limbo at the minute. So that's why I need to find out what I can get, to help me.
If you imagine the situation, somebody's watching this who's also got quite a serious condition, quite a grave cancer in a way, and they're wondering how to maintain that positive outlook because they just keep focusing on some of the negatives which come to your mind, quite regularly.
Oh yeah, that's something that's come to me. Yeah.
What would you recommend to the, that viewer that I described?
If you finding it very difficult with the cancer, you must not bottle it up. You must find somebody you can talk to. Now there is great support which I found with Macmillan nurses, and the Leicester Royal Infirmary. There's a big stand and it's got lots of information on, and people will even come out to the house to see you, which has happened in my case. So you mustn't worry about it. You must pick the phone up, speak to somebody, or get somebody to come and see you. Trust somebody to help you.
Did you access
GP? Go to
the
GP.
GP. That's a good one.
You must go to GP. Now, this is a negative sort of thing because I was told to ring the nurse in my situation, but she's never there to speak to me.
Did you access the voluntary sector coping with cancer we have locally?
I did ring up before Christmas, but unfortunately I had to cancel the appointment. She would come to their house, so I've heard they're very good. I've got their number at home. Did
you try any groups, or did you try any, what sometimes we call it peer support, which means meeting other patients who have been through it?
I've only met the neighbour's got cancer, but I'm going to. Now I feel like I need to go to the group, to start a group now, to go into a group, to get some, to get some feedback. And Heather's been through some as well, and she was saying, not much chance to talk about yourself yet, have you?
So let's think about how your family coped, because you mentioned your children, 7 children, I think, at the beginning. How have they all reacted to your illness, especially given that they wanted you to have a treatment that you declined? Did that affect anything?
It caused a lot of problems because I didn't want to have that nuclear scan because of the radiation, and I cancelled one before they could, so there were no costs to the National Health Service, and it caused a lot of upset. And I did a runner. You're gonna think I'm crazy now. I ran away. I just went off to in Norfolk. There's a shrine called Walsingham, and I just packed my bags and went away a few days. It was that bad for me.
What precipitated that?
The pressure from the family telling me to have the because I wasn't going to have the operation at the beginning. Some people, I just felt like I couldn't cope with it.
So you needed to get away, and you had basically a break, and then presumably came back.
Because it affected me so. I don't think I'd have come through as well as I have done without my faith and the support, obviously, because God works through people. You don't just drop down and say, do this and do that. He works through Dr. Mitchell and works through the other, and that was, I forgot what I was talking about now.
That's interesting. Not everyone has a strong religious belief, of course, but you do, and it's a comfort to you.
It has helped me. It has helped with but like I say, you need to use the people as well. You know, that's how God works. He works through people, you know, surgeons and everything.
Well, that's an interesting way of looking at it.
I don't want to come across as a preacher.
Yeah.
It's in my situation, my cancer, it's helped me immensely. I go to mass every day. I retired from my job. I'm at medical retirement before I got the cancer. I worked 15 years, so I get a little pension. I do a lot of voluntary work, and
let me ask you a question there about
another drink.
About the spiritual side.
Yeah, spiritual. That's what I was saying. That's what I'm saying, because some people might think, you know, you're trying to preach.
No, but I'm just interested. Do you can you understand those people whose faith maybe wavers when they've got a sudden diagnosis that they weren't expecting, because they think, why have I got this?
I did think about that question, you know, and like in my circumstances, lung cancer, I was told by the surgeon, was caused by my smoking. So I accept full responsibility, but I did wonder why I'd actually got it, just losing 2 people in my family. But I don't blame God. I don't, you know, what I'm saying is I don't blame him, but it's happened. It's no good saying it's not happened, because it has. And so I don't know, sometimes I don't know the questions and answers, but the thing is now I've just got to get on with my life and as best I can, and hopefully with the support, you know, from everybody, if it comes back or whatever, it's best to take one day at a time and see what help I can get and try and live. Like I say, I'm going to Lord's, and that gives me great lift. Oh,
you've been going back there, have you?
Oh yeah, I'm going back to actually carry on living.
Yeah.
It is always there. I can't explain. I don't know whether you've got the same thing, Heather. It's always there, isn't it? But you don't sort of think, I don't know, as time goes on. When my son died from drugs overdose, somebody told me she lost a child from drugs. She said, you'll never get over it. The pain will be really bad. And you know, when it happens, the pain is bad at the time, but it does get better.
Yeah, so you've noticed maybe that you're thinking about it a bit less than you were.
Yeah, I do think about it, but not much less so.
Yeah.
And of course, you know, cancer, you think of death, don't you? The word is, you know, the actual, the programme on the telly the other day, Death Row, is like being on death row.
Yes.
And I don't want to sound negative, but it's a devastating thing, because you think of cancer, you think of death, and everybody seems to be getting cancer now, and it's very frightening.
But do you think that view is really warranted, given the improvements that are happening and the fact that people like yourself can do well for years afterwards? Do you think that maybe we should reevaluate how we think of cancer and maybe think of it as something we can come to terms with in many cases?
Well, I think we're advancing now, aren't we, with cancer and research, and let's hope there's a cure. It's hard to answer that question, Sammy.
Where do you see things going for yourself in the future?
Well, I just live one day at a time. You can only hopefully live one day at a time, and I hope it doesn't come back. And if it does, I just have to accept the help from the people who work to help me.
Yeah. Do you think you have a positive outlook at the moment?
Yeah, I'm trying to be positive.
Are you making any?
Some days are good, and some days I get me down days.
Yeah.
Sometimes I cry with I think sometimes I can get very weepy. But there's always somebody worse. When we're saying to Heather, there's always somebody worse off than yourself.
That's why I wondered whether you'd had the chance to meet other patients on a regular basis.
No, as I said, I'd like to start doing that, because, you know, it's just, the reason I think is stop doing it is because that means you'll be talking about cancer, like during Weight Watchers, you talk about food, when you need to lose weight, you're going to see people with cancer, you're going to talk about cancer.
I understand.
And so I've sort of stepped back a bit.
Yes.
But it's hard to explain that, because I'm a people's person. I like people.
In a way, you'd like to just talk about normal things with people, not cancer all the time. You'd like to get away from cancer from time to time.
Yeah.
And you worried that, you know, if you were having too much exposure to other people with cancer, it might be dwelling on your mind a bit too much.
Yeah. Well, I met a lady in the scanner with cancer. We got friendly and I ring her up regular. And she's completely different to me. We've got to, something just come out in my mind. We're all different. Every single person on this planet has got different, fingerprints. Nobody on this earth has got the same fingerprints. We're all unique. Everybody's different, whether you've got lung cancer, whatever cancer. We're all going to be affected differently. And as I say, I'm not saying it's been easy, but it's with support, it is getting better. And I need to carry on living. I'm only 60. I'm still young, and I need to carry on living for my family, for my children, and be positive. And I want to be, hopefully, help to other people, not a burden, not a depressant. I don't want to come across somebody in the church and comes up to me, oh, how are you getting on with your cancer? Oh, I've got a bad cough today. I've got, bronchitis. I don't want to be, I feel great, I just want to be happy and positive and healthy.
Now, is there any particular further advice that you'd give? Think again about somebody watching this, hearing your story, which is quite in-depth, Is there anything in particular you'd want to say to them?
If anybody's got cancer, it is a very frightening situation to be in, but please accept the help. Phone somebody, see somebody, speak to a good friend, go out for everything you can get. Even if you have to go to the GP, make a double appointment, don't worry about anything. Remember it's yourself, you're a very unique person, you're very special, and you need to get help. And there's lots of people there's a lot of good people out there. Actually, since I had the cancer, there is a lot of support, a lot of very good people who work in this field, a lot of good doctors, a lot of good, just get the help. Don't bottle it up, because I thought I was quite strong, but I have my off days, and I have to go and get some help. And I actually went and asked for some help, and I got this psychologist lady to help me. And I never thought I'd need to have that sort of help myself, because I help other people. Yeah. So to really stress, don't feel like you're a burden. You're not a burden. It is an illness, isn't it? I mean, you need to get some help. Yeah. I don't want to sound like OTT, but I'm a bit more, since I had the cancer, I'm a bit more like, because before when I was the cough, they didn't even send me for an x-ray for a year. I was coughing my heart out. So I'm a bit more, if the bird flu come out, swine flu come out, you go and get your flu jab or whatever. I do everything now, I do everything I should do, except for that chemo.
Looking back on everything you've been through so far, is there anything you would have changed now?
Yes.
What's that?
Never smoke a cigarette again.
But at the time you were smoking, were the risks really clear to you?
No. Started when I was young, about 9.
Yeah. And I bet a lot of your friends were smoking as well then.
Yeah, I was in a gang, the gangs that you're in. You got to smoke, you got to drink and keep in with the gangs, but...
Absolutely.
No. It's really bad for you. I would, every time again on the earth, I'd never smoke.
Probably before you knew it, you were smoking regularly.
Yeah, luckily I weren't a big smoker, but I still got lung cancer.
How many years did you smoke for?
About 30 years, isn't it?
And how did you give up in the end?
I watched somebody in an intensive care unit dying of, my husband actually. He was nearly dying of pneumonia. Never touched a cigarette in his life. And I packed it in that day. I never touched another cigarette. That was my husband. He was giving up for dying. His kidney had failed. His transplant had failed, and he was dying. Septicemia, pneumonia. Yeah. And that's when I packed in smoking. Without no drugs. Just like that.
Well done.
I know. I don't know how I did it, but I did it.
How's your husband getting on now? You mentioned him earlier, and he had this renal failure as well.
Yeah, it was difficult after the operation. Oh yeah, it's been very hard, but obviously it's a big operation, isn't it? Lung cancer, having half your lung out. They cut you for a start. I don't tell people about the operation to pull them off. Didn't get told much about that.
No. How long did it take to recover after the operation?
Well, it's now about 6 months. I'm feeling a lot better.
Are you?
A lot better. I've had breathing problems, but I'm feeling better.
Were the breathing problems as a result of the surgery or something else?
Well, I don't know, it's surgery. I've had a lot of trouble. But
You feel 6 months later you're feeling more like...
I don't feel 100% better, but I feel a lot better.
Yeah. Are you making any plans for the future?
Yeah, going to Lord's going to Lord's.
Great.
And my daughter's getting married, so I've got a lot to look forward to.
Excellent.
My beautiful daughters, I've got a beautiful family. I've got 4 beautiful daughters and got 6 grandchildren. So I need to look after myself for them.
I agree.
So I'm going to, Easter's coming up. Beautiful. The weather's going to change now. It's going to start getting nice sunny weather. And I'm going to Easter. I'm going to Lord's for Easter with my husband. Really looking forward to that. For 2 weeks. So I'm really excited.
Good.
I'll get my lift, you see. I get my lift from, that's my cigarette lift.
Well, look, I wish you all the best for the
thank
future.
you.
And thanks for sharing that valuable story with us.
Sorry, it wasn't very good.
No, I know the viewers will find it helpful. And like I said, there's not been many people who've had lung cancer and also made the choices you've made. And, you know, people have to respect your choice at that time, you know, about the chemotherapy. It'll be hard for some people to understand. But then again, some people are also considering that same thing. So hearing your perspective on it does help. So thanks a lot.
Yeah, that's the only thing I could say. If I get any problems now, I can only blame myself, you know, with the chemo. But I'm glad I didn't have it really, because I've been quite poorly.
Well, don't forget, you can always access treatment in the future if you need it, even if you decide against it at the time.
Yeah. Well, they sent me a letter saying I can only have palliative care.
Palliative care, yeah, that means symptomatic care to reduce any complications relating to further deterioration, to basically improve quality of life.
Yeah. I'm glad I come today now.
Good, okay, thanks a lot then.
Yeah, it's been lovely. Thank you very much for your time and everything.